Hi there, I'm Jeff Merritt, and I'm happy you're here. You're in good company, a show devoted to bringing out the good so we all become great. Today, we're going to talk about local healthcare during COVID-19. Joining us today are Kim Rowe, Vice President of Family and Community Medicine at Carilion Clinic. Kim, thanks for joining us today.
Good to be here.
We also have Dr. Ann Newman, who practices general dentistry here in Roanoke. Ann, good morning.
Thank you. Good morning.
And we also have Mike Bram. Mike is the Senior Vice President and General Manager of Trapalo. Mike, thanks for joining us as well.
Thank you.
All right, Kim, we're going to start with you and we're going to just jump right on in. The impacts of COVID-19 are everywhere. They're impacting everyone, and not the least of which is the healthcare community itself. Can you talk to us a little bit about how it's affecting those non-emergency healthcare services?
Yeah, Jeff, you're exactly right. We have had a large impact really starting about the end of March and continuing on now, and we'll, of course, be experiencing this for a while. When you talk about our non-emergency healthcare services, we're really talking about the ambulatory environment and those outside, of course, the hospital walls. And there's been a large impact. And primarily we've had to pivot immediately into thinking about different ways that we take care of patients. And that has included almost overnight starting video capability and telephonic outreach, and how we actually structure and decide which patients really should come into the clinic to be seen, which can be triaged differently, and which lend themselves better to a virtual visit rather than an inpatient. How we get labs is different. How we bring patients in is totally different. So overnight, we starting towards the end of March, and certainly we experienced that in April, this new norm developed for us. But it's been a rewarding experience. And I think the most important part that we've learned from this is how do we be proactive and actually use some of our care coordination team in reaching out to our vulnerable populations to ensure that they've got their medications, ensure that they've got the food necessary. That was so important during the time when we were all shut down. Now we're in a new normal phase of what our new normal looks like. And so our patients feel, much different and much better about coming in to see us. And we're glad to have them back in the clinics.
I can imagine it's been quite a transition period, and as you mentioned, that March to April timeframe. We'll talk in a few minutes about some of the things you are doing to be proactive and to let those patients know what to expect when they come in. But Dr. Newman, let's shift to you and talk a little bit about the dental field in general. I imagine with everybody wearing masks in different places, that's one form of prevention, but that's obviously not possible in the dental area, and so. Maybe you can share with us a little bit about how you've reopened your practice and some of the approach that you've taken to ensure the safety of your staff and your patients.
Yeah, sure. It was, like Kim was saying, it was not a easy process to get back into things, but it's really just a lot more about finding that new normal to allow us to take care of patients. I first have to acknowledge that I have a really wonderful team that I work with in my office. So I certainly couldn't do everything that I'm doing by myself. But prior to reopening our office, my team and I met to review our patient experience from the phone call to arriving in the parking lot to entering the building, proceeding through our appointment, and finally checking out. We reflected on a lot of the guidelines that were provided to us by the ADA, the VDA, the CDC, and as a result, we came up with a system that has been really successful for us. We pre-screen our patients over the phone. This gives us a chance to describe our process and establish expectations for a safe experience. And when our patients arrive, they call the office. Also, like Kim was saying, they wait in the parking lot. We call the office and we screen them in their car, which includes a questionnaire, temperature check. We measure their oxygen saturation, and if everything passes, they're invited to proceed into our office. We have made every attempt to try and reduce the number of potential patient-to-patient interactions, but everyone in the office is expected to wear a mask or some sort of face covering until, of course, we need to be in the mouth. Our office has implemented a lot of additional levels of PPE, including N95 masks and face shields, surgical gowns, and of course, gloves. We have a new scrub policy about where we change them and when we're changing them. And like a lot of offices and public places that other people have been, we've installed plexiglass at the checkout process. But you kind of touched on a good point about the issue with working in the mouth, and with our job, we generate a lot of aerosols, potentially aerosolizing the virus. So one of our goals was to try and reduce that, and as a result, we implemented some additional pieces of equipment, for example, for my hygienist to be able to work with extraoral suction, and we also implemented a fog machine with a clean and safe chlorine-based disinfectant solution that we use twice a day, all to try and manage some of the aerosols that we could potentially be generating in the office.
That is a tremendous amount of transition in a very short period of time, and I can only imagine the training that your staff had to do in preparation for that. And so thank you for sharing that with us.
They're awesome. They've done a great job.
Absolutely, it sounds like they are. Mike, let's go to you now. And first off, folks who are viewing may not be familiar with Trapalo, so I'd like to give you an opportunity to share a little bit about Trapalo's core telehealth services and how you're helping the healthcare community during COVID-19.
Sure, thanks. And thanks for having me on the show. Trapalo is an organization we celebrated our 10-year anniversary just in April, where we really serve the community dealing with supporting with telehealth and with remote patient monitoring, especially for those patients that are chronically ill, maybe have one or more different disease states. So for really this last decade, we focus on how do we work with hospitals, how do we work with also insurance companies, even large employers, to be sure that as someone may be needing to stay at home but yet still having a lot of connectivity, with their care team, we provide those devices. We actually are doing that all across the United States, just not here in Virginia. And we help, again, to come alongside and work with clinical workflow. We then provide the appliances, the blood pressure cuffs, all the different things that you may see in a regular doctor's office to that patient's home. Help them get the readings, and then can redeploy these kits, as we call them primarily, so that no matter what the environment is, we're able to get it inside of someone's home. But what's really neat right now also, and what we thought was going to take about another 5 years maybe with all of the regulations change, what we thought was going to take 5 years really kind of transformed as we're all seeing it in the first 5 weeks of COVID. And so for us right now, it's really been a blessing for us to take something which we've already been well practiced in, now be able to actually accelerate as the market and as the things are accelerating in telehealth. And so for us, we're able to, if it's in a wireless environment, so we're really helping to serve both the rural and urban underserved communities in America, and especially when you're talking about the disparity of care, which has so much come up recently, this is one of our areas of expertise. So if someone can reach a cell tower, we're able to reach them and to deliver care.
Thanks, Mike. And maybe a bit of a follow-up question to that. Obviously, certainly keeping those folks from entering the hospital, the emergency room, given the pressures that it's placing on, that COVID-19 is placing on everybody, is critical. Have you implemented some additional resources or tools to help those employers or those hospitals or doctors' offices with managing their employees and reentering the workforce there?
We sure have. Actually, some of the things from the regular part of our solution set, we're actually working with hospitals for those people that don't need to, let's say, be in the hospital quite as much. We have a hospital at home solution, which we've built off of the same platform, which allows for, again, those non-critical patients or patients that would normally be in, let's say, the hospital for the first 3 or 4 days. They're still admitted, but they're actually in their home getting those services. So on the patient side, that's working. Then with that exact same platform, we're able to repurpose it so that now we created a COVID-19 specific application, which really allows for the pre-screening and whatnot, as we're hearing about, from the having the devices in that home. Well, now we've taken that same platform, it's the third, essentially a third iteration, let's say, to help companies open back up so that we can provide surveys electronically over their cell phone. We created a bring your own device solution so that on your cell phone, you literally can just download the app like you would on any other Google Store or Apple Store, be able to pull the app down, be able to enter in the pulse ox, enter in your temperature, answer a quick survey, and even if you need to, all in the same app, it also does video two-way face-to-face as well, because you don't want someone showing up into your business sick. You want to be able to identify them in advance so that you don't have to worry about getting anyone else ill in that environment. So we've been very, very, very busy in this time and are happy to help.
It's a great application, a great way to transition the technology to really support not just the healthcare industry, but everyone. And so thank you, Mike, for that explanation.
Thank you.
Clearly, the experience of visiting a doctor is different today than it was, just seven months ago. And Kim, we have a short video here that I think speaks a little to that proactive work that you mentioned earlier around preparing guests. Would you like to say a few words before we roll that video?
Sure, Jeff. I think the video speaks well of if you're a patient in our facility or coming to any of our outpatient facilities, you're going to expect the same thing. And the video really demonstrates the initial outreach to the patient that we make prior to their visit, what they can expect when they go through the visit, and then how we can use tools like MyChart, eCheck-in, so that we minimize the amount of contact that the patient initially has with staff. And some of these things that can be done electronically, we want to encourage that. So the video, I think, does a nice job of really letting the patients know what to expect when they come into the clinic.
Awesome. Well, let's check that out now.
Safety is our main priority for our patients and our employees. That's why we have developed a carefully reviewed, step-by-step process to ensure you receive the care you need in a way that exceeds COVID-19 guidelines and recommendations. Here's what you can expect when scheduling your in-office visit. Call your provider's office to request an appointment. We'll talk about any recent travel, ask you about whether you're experiencing symptoms such as fever, cough, unexplained joint or muscle pain, and we'll find out if you've been in contact with a person who has or is suspected of having COVID-19. You may choose to complete this registration process online through MyChart. If you don't have a MyChart account, your provider's office can help you get set up. Most Carilion primary care or specialty care locations follow the same steps for checking in to your in-office visit. When you arrive, you can simply call the practice from your vehicle to let them know you're there. You'll be screened for COVID-19 symptoms, and a staff member will take your temperature. If you don't already have a face covering, you'll be given a mask. For your protection, all visitors, patients, and team members are required to wear a face covering or mask in all Carilion Clinic locations. Please note there are visitor restrictions at all of our locations. Visit CarillionClinic.org/safe for up-to-date visitor guidelines and recommendations meant to keep all of us safe. Social distancing measures now allow for plenty of space between patients in our lobbies and common areas. Surfaces such as door handles, elevator buttons, tables, and chairs are cleaned and disinfected frequently throughout the day. We have spaced seating options that meet social distancing guidelines in our waiting areas. At most outpatient facilities, you'll bypass the waiting area altogether and be taken directly to an exam room. If a short wait is necessary, let us know if you prefer to wait in the privacy of your vehicle. Your provider will complete the visit as usual while using a mask and face shield, practicing hand hygiene as an extra safety precaution. When your visit is over, your after-visit summary may be printed, or if you prefer, we'll mail it to you. And you can also take a look at it using MyChart immediately following your visit. Since we want to keep foot traffic flowing in one unified direction, you'll likely exit the facility through a different door so that the entrance is clear for other arriving patients. You may decide to complete any necessary follow-up visits from the comfort of your home. Check with your provider to see if a video visit may be right for you. Thank you for being part of helping us keep our patients and our employees safe, and we look forward to serving your healthcare needs in this new and evolving way.
Kim, thanks so much for sharing that video. I think it does a great job of explaining to folks kind of what that experience is like. Mike, at the end of that video, we heard a little bit about the telehealth options, and particularly some things around perhaps a video conference, as you were talking about a little bit earlier. Can you talk about the benefits of patients using this technology and maybe some of the added benefits to the healthcare organization itself?
Absolutely. I mean, when I said earlier we thought that maybe it's going to take another 5 years of change and transformation, so many of those were whether it be comfort in using a platform or whether it was the regulatory about compensation of meeting someone face-to-face versus over the video. Every element, what we've seen, is in the process of changing. And we saw that doctors quickly adopted to use this two-way video that we're able to even demonstrate right now. This is the same type of environment that folks will use when meeting with their doctor. For me, I don't mind sharing, but I needed to get a back operation actually on February 29th. I went through all kind of processes of waiting and then ultimately getting surgery just a week or so ago. But with that, I was looking and talking with neurosurgeons in this environment. I was also then following up with my all of my doctors essentially on two-way video. So there's been a great comfort level that people thought maybe previously that both the doctor and the patient might not feel comfortable in that. And one of the biggest myths was that seniors wouldn't be enjoying this. But we've seen that change as well. And in my own personal word, my father, 88, he too was having this type of video conference with some of his doctors. So it's really allowed us to both now provide an environment that people, in many regard, can be seen when and where they want, in an environment that's comfortable and safe, in a technology that's now as comfortable as just doing a Skype call with your grandchildren or with your neighbor or with your friend, and the appliances and the other things that are used, like again the blood pressure cuffs or thermometers, weight scales, a host of other things, are all available typically in someone's home, and they can either be connected or not connected automatically. There's just a whole range of ways of where people are trying to make the adjustments. The wonderful folks at CMS now are also changing the rules and the regulations to make this a little easier to happen and to reimburse it appropriately. And then with really the technology has been there for a number of years. Now really it's getting all of us as both the patients and the providers comfortable in continuing this. And again, as I mentioned a minute ago, the part that I'm so excited about is this really is a solution in dealing with both the rural and the underserved communities in the urban environment, that folks can now have access to care better than ever before. So the disparity of care is really one of these areas that I think can now be championed using these technologies.
Mm-hmm.
Well, the adoption, I think, is remarkable, as you mentioned, Mike. I mean, the seniors and technology may have been a concern at one point, but based on what you're saying, it seems like that adoption is pretty widespread. And I'd like to wish you all the best in your recovery as well. Thanks for sharing that story.
You bet.
Dr. Newman, let's shift gears a little bit here. One of the things that we're hearing about are patients avoiding going to the doctor or dentist for their regular checkups, or holding off on perhaps even more serious procedures. Can you speak to this? Are you seeing that? And what are some of your concerns with this?
Yeah, so that's a good question. Initially, I wasn't even really sure what our patient response would be. Of course, there's a good mixture from patients on some decided that they wanted to hold off on some of their dental work for a few months, but I would argue actually in my practice, generally, it seems that most of my patients were relieved to come in and thankful to get some of the things taken care of. And perhaps it was one small element that people feel that they can control in what otherwise feels like an unpredictable world right now. I don't know. Maybe it's the fear of potential dental pain, or maybe it's as simple as people slowing down their personal lives and taking a moment to realize the need for self-care that seems to be driving their interest in dental care. My team could tell you I love meeting new people in my practice, and I always probe this question: why dentistry and why now? And the most common response lately has been it's simple. It has been a while and it was time. There's a lot of good research out there about the associations between oral health and your systemic health, specifically looking at associations between gum disease and diabetes or heart disease. Even COVID is no exception. The British Dental Journal published an article in June, I think, about the association between oral hygiene and the severity of COVID infection. So back to your original question, in my practice, it doesn't seem that people are holding off from their checkups or more serious procedures, thankfully. For many of my patients that are seeking care, they're for obvious reasons that cavities get bigger and gum disease gets worse. But in putting off dental exams will delay identifying these areas of dental decay, and delaying minor procedures like small fillings end up in more extensive and more expensive treatment down the road, even in our office, tooth loss. But in the bigger picture, I feel that dentists really want to guide patients to good oral health for an even better overall health.
That's encouraging to hear that folks are taking that perspective. I'm thrilled to hear that you're still seeing that volume of patients coming in, and I imagine that it's somewhat overwhelming considering the fact that most dental offices were closed for a couple of months here in Virginia for a while, and so I'm sure you're working through a bit of a backlog there.
Yes.
Maybe we can transition and ask a very similar question to you. I mean, we also hear these concerns about folks being afraid to visit the doctor's office because they think there are going to be other sick people there. That's kind of age old, but certainly with COVID, it's to a heightened level. I mean, what sort of things are you seeing, and what are some of the concerns that you and Carillion have?
I think that was true early on. When everybody was trying to figure out, what is really COVID? What are we trying to deal with? How is it spread? There was so much information that was coming in early on. And we did get that from patients that they were afraid to come into the office. But now we've seen through our research that has really diminished, and that people are feeling more comfortable about getting in, and they're actually, just like Dr. Newman said, glad to be coming back in. They know that they've put off some care. And the ability to come back in and get their blood work has been something that we are really seeing this summer as people are trying to catch up with where they were in their healthcare maintenance abilities. I think, when we talk with patients ahead of time, and just like the video demonstrated, we're setting the expectation with them so that they know what to experience and expect when they come in. That alleviates a lot of their fear, and the fact that we are really concerned about their safety, not only our patients' safety, but the safety of our staff and our providers. So all of those working together, I think, make it a great environment for patients to be able to trust again and trust their healthcare needs, and also giving them options, just like Mike mentioned. If you don't feel comfortable coming in, then we now do have a telehealth or a telephonic outreach, a visit that we can offer to you. Thankfully, the regulations have really shifted to allow us to be able to do that in a more congruent method than we had before.
Well, Kim, let's stick with you. I mean, we heard Dr. Newman mention a few resources. I think she said the American Dental Association, the CDC, and other resources that she used in terms of opening her practice. And I'm sure that Carillion's doing very similar, using some of the similar guidance from the CDC. What other sources do you use for making those decisions around opening and other processes that you're using? Where are you gaining that information from?
Well, certainly the CDC was instrumental, and then, that and the coordination with our infectious disease doctors, and really setting a plan for Carillion, but also each organization. So for family practice, it's been the American Association of Family Practice that has really helped in developing guidelines for primary care practices. Orthopedics Association, same thing for them. So your national organizations, as well as the coordination of the CDC. And then we look at also how do we coordinate with what's going on in the state through our Virginia Health and Hospital Association, as well as our local governments, to really communicate and be in sync with each other. And I think that's been very helpful going forward.
Gotcha. And Dr. Newman, similarly, you already mentioned the ADA and CDC and a lot of those others. Are you? Is there a best practice sharing or some opportunity that the local dentist in Roanoke use to kind of bounce ideas or recommendations off of one another?
We're a pretty good group, especially here in the Roanoke Valley. So I think picking up the phone and just getting personal feedback, seeing what other offices are doing. I've talked to one of my specialists is working with a company on a prototype for a new PAPR, or a positive air pressure system. And so we're excited to see where that's going to go. I've talked to another office that is 3D printing some specific pieces of equipment to aid with working with their face mask system. So really what I've learned from this experience is you get creative and innovative, and we've really gone far, leaning on each other.
Excellent. Well, it's great to hear. Well, as we bring this to a conclusion, I'd certainly like to thank you all, Kim, you and everybody at Carillion. We appreciate all that you're doing. Dr. Newman, thank you so much for sharing your experience with us and what you and your peer dentists are doing in navigating this world. And Mike, certainly thank you and everything that Apollo is doing to help maintain that telehealth and those connections with those patients that are incredibly important right now. So thank you all so much for joining us today.
Thanks. Have a great day.
Thank you.
Again, I'm Jeff Merritt. You're in good company, a show devoted to bringing out the good so we all become great. We'll see you next time. Thank you for joining us.